Awhitai ke eiki, maloi lele kai ngā tonga kotoa pe o mū kau mai ke polokalama Lave Mai. Ko hingoa ko Dr. Seini Taufa, pe ko hen whaataha mui kau ngā we Dr. Losa Moata'ane, ke tau ke hoko ate talanoa na e whahoko i he wike ko osi. Whikau aki moi COVID hiva, moi whakawhiloa ki atu ai tau ongo immunologist tonga ko Chris pa mo Dianne. Ki mua pia hoko ate tau polokalama ko whawhi ia Chris ke ne whahoka tau ki lotu malo.
Aloha wit, ke tau lotu. E o toa mawhamawhaka mau ta mai whakaiwane a whiona. Oku mau hangati he ahoni pe mo e whakamalo ma whawhetai e te koe hui ko ho tau i hao ko ke whaima mo ngai mo ui malawa ke mau o sia mai e whakolo koin pe mo whenga maari e koin oku mau e o toa oku mau wakakai ki a takai oku mau iai oku mau whakamoni koe o toa oku mau tau ki aiko o toa oku mo oni pe o ke whahano tokanga i kina mono tokanga ia mau ngai mo ui kai ngata pehe mo ui whakasino kai mau mo ui whakalau maari e whoki o ke o mea e wholofola uni hoko koe mea kai whakalau maari e ka teki mau tolu pe mo o whanonga ku mau whai e o toa oku mau hanga atu ko hui koe polokalama ua mana ke mau whakahoko e whiaf koen ko mau ngai palani e mga hi whotutua tua ko mau ka mau ke i whakawhi e pe i whalau maari e mai noni kine whai hono toko nia ki mau tolu whakahoko le rea ngai polokalama pe a whatawange hoko e ngahi pōtala no te mo whahoko e whiaf koen ko a mea tene hanga langa ke mau ngai mo ui whakasino kai peke le whalau maari e whoki pe a koha mea na koha mea ia e aonga ki ho mau kakai i kai ngata pe inu silani o tōka i he ngalo o pe whoki pe a mau kore ko ki nau tolu nau whototoa e polokalamani o toa e whaitokonia mō whai vea ki nau tolu ka hoka ngai whaitonge unau whuesia i he community kai pe whoki ho nau ngai whamiri whoki pe a kimana ko ki nau tolu o toa unau whai e pōpōtara no e whewhin ke hifo mai mo iwo lau maare maane o ni o whai hono tokonia hono whakarea ngahi polokalama ma ngahi tala noa e whakatutu ke whakahoko i whiaf koen koe mau ngahi lotu e o tua ko hakat ki a whiona tokonia ki mau tolu pia whakakata mau te kakato mau kore katoa ngai mana si sukalaisi ko aloka ko mau whamui eme.
Malo apito Chris. I've done the introductions, I've done the welcoming in Tongan, but for our non-Tongan speakers, welcome to the Lave Mai Show. My name is Seini Taufa and I'm here with my co-host, Losa Moata'ane, and we are privileged once again to introduce our two Tongan immunologists, Chris and Dianne, who spoke 2 weeks ago. And there was quite a bit of traction, a lot of questions that we weren't able to answer because of the limited time. So we thought that we would introduce Chris and Dianne again, just to go over their presentations and for us to be able to finish off some of those questions. Big shout out to the Lave Mai Show for allowing us to use this platform. Hile kulea ko kole ka Chris ka ma Dianne ke nautoe whamatala ai ngahi mea koe na e whamatala ki mua i in our presentations. Malo opito Chris, I'll hand it over to you.
All right, Seini, I'll just share screen. Alo lerei, kai ngā tonga kotoa pe, ko kui ngā ko Chris. Pea koe i waki konga koni o ki presentation i te utara noe o whekawaki pea moe wailasi koni ko SARS-CoV-2 pea mga hi paraparema o ku o whepake kakai moe a hiri nau mau koe e COVID-19 pea ka hiri o ku whahoa a te o angere o whekamaria ki a Dianne ke ne whakamatala whekawaki pea mahuhu malu i pea pea moe ne ngā aue moe anga we sia e COVID-19 ki e kakai Pasifiki i kai ngata pe i New Zealand ka i ngā loa pe whuki. Ko hānei uhinga e COVID-19 ko hono Whakaloloa goia o COVID-19 ko coronavirus disease wa whetahiva. Ko e mahake whakoni ko COVID-19 o whakatupuia e vailasi o ku iloa ko SARS-CoV-2. Pia kono whakaloloa e o ku stands for Severe Acute Respiratory Syndrome Coronavirus 2. Pea o kea ngai whakamatala whakasainisi, ngai whakamooni, o kune whakahaa mai ko e vailasi o kumalawa beia ke mowhere, me ngahi monmanu ke whangape whakatapu, o malawa le vai ke mowhere ke whahinga tangata. Pea o ku na tau sio whokiai i he kōhiri o whikawaki pea moe ngahi vailasi ke he koia ko SARS, pea moe MERS. Pea o kea whakamatala moe, mga whakamoen whakasainisi o ne tala mai ko na tula tatau pēni e mowhere koe ni a SARS-CoV-2. Pea koe vailasi whoki koe ne na tula aia o wheliriwak ma pē i he taim kotoa pē. Pea i he ne malawa koe ke wheliriwaki o malawa le vai ke mowhere pea me he whangamon manu o wesia e whahinga tangata. Ne na tula pehe pē, o na tula pehe pē whoki a SARS-CoV-2. Ko COVID-19 ai o ko mo mea ai o whakatu palparema au pitu. O ku riunga wanoa e ne whakatu tāmaki ke whainga tangata o whakatatau ke flu whakatu tāmaki taha ko tau siausia. Ko wesia whakai e maui e toko ofi ke toko uangea ni manoa miliona pe ko more ngahi maui o toko lahianga i nima miliona i maamani. Pe ko ngahi ripoti mga whamatala kehe o ku te lahi ange whoke e whikai a koe ni whakotua mo mate i he tainimi. Pako whika whoke o hiki whaka aho maupe. Hiri koe a COVID-19 o ku waengahi palpare ma kehe o ku e si ai mo ui toko taha kotoa pe ai kakai toko lahi. Pako ngahi palpare ma koe ni o ku ka long COVID. Ko ngahi palpare ma o ku te whea a moe ngahi mahina lahi hiri koe ai COVID-19. Koe ki whakamatala ni ki ka pate tahonga whakaatalahi ai vailasi o ku peheni ai ni whotunga. Pea kono ngahi konga kehe ni. Uia ai spike protein. Koe konga whokena o ngā aki he vailasi ke huai ki he ngahi kupu aho tau sino. Pea ko ngahi spike protein ko ni pea koe tau o kwa i he koftua. Pea ku kofu e le vai a lipid membrane ai o ku neanga malu e ngahi konga kehe o vailasi i loto. Pea wea lewa RNA ko ngahi whakahino ia. Pea koe palani ki hono ngāhui mono whakotu ai ngahi konga mo ngahi kupu kehe koe ni o vailasi. Ai koe ngahi whakahino o ku nofo i loto koe. Pea wea lewa nucleic capsid o ku ngai aken e kausaini sike nau komi pe o ku iai pe o te koe e vailasi pe kai. Pe o ku toko ni ke whakawhanau mo where atu ai vailasi. Ko o peheni whoki ai nā tūlai wheliuriwa ki koe ni ai vailasi SARS-CoV-2. O ku malawa ke liriu ai ngahi kupu kehe koe ni o vailasi. Pea koe ngahi liriu ko ia o ku hoko ia i loto i he RNA pe ko whakainohino pe ko palani ki ono ngahi mono whakotu koe ni o vailasi. Pea o ku malawa ke hoka ngahi liriu ko ni e taimi o ku whakawhanau mau pia ai vailasi. Pea i hoka ngahi liriu ko ni loto o ku haa ki tu ale vaia. O malawa i he vailasi ke ne mau hawhotunga o ku who nei pehe tohpe ai wheliriwa ki koe ni ai SARS-CoV-2 o mau ai koe ni ai Delta variant ai o kumu mea i ngahi aho ni. Pea i kake ngā tai o ku malawa pehe ke whekolosi aki ai ngahi konga kehe o vailasi o nau mau ai whotunga i ata o ku toike. Ka koe hono mahu inga ko te loloanga taimi o tau tuku ke whakawhanau ai vailasi o ku tau oanga ai whainga maarie ke te whiliuriwaki ki ne mau ha whotunga taha o ku who'o. Koe Delta, COVID-19 Delta variant ai ko mo mea i o ku mowhere ngofua. Koe flu whakatau, koe tō taha puke malawa ke mowhere ke toko wake. Koe COVID-19 whotunga motua ai ana tau raki whetaulaki moia I New Zealand ngahi I tau kosi. Ko tō tāu puke umalawa ke mo where ki toko tolu ke. Ka koe Delta variant ko toko taha puke umalawa ke mo where ia ki toko o fitu ke. Ai au fu mahu inga pito ke tau whakaehi e taime ku tau mea toai ki into the public pea ku whemau ke tau nofo o toka ngai e tau ngai pāpolo ke tau safety foki pea ku mauinga pito ke tau tu e tau maasi mo whanawhana mau pito tau ni ma ke tau whakasii ai a whenga maari ke mo where koni ai vailasi. Ia ki whatātā koni ko loto ke vahe ai anga e ngāwe ai vailasi ki o tau sino mo anga e mau o koko I o tau sino I kai ki ngatai ka ke hului ai mahu inga koni ai antibodies peko mahaftau o ku ngāhi e system malui. Ia taime ku tau mau ai ai vailasi o ku ngau ake e he vailasi ai spike protein peko ki tau kau ha I ono koftua ke ne piki ke ngahi konga peko ngahi kupu a tau sino. Hange koia I he whakatata. Pea I nau piki koia ku nau hurewa ki loto o ka matai e nau whakawhanau pea ka matai ke nau maui ai ngahi konga mo ngahi kupu a tau sino. I hene pehe o kune hangarewa uki ai ngahi sotia malui o sino peko system malui o nau hangarewa o tamatei ai ngahi konga mo ngahi kupu o sino ko hua e vailasi. Pea nionga e taimlau tau peko ngau le rei eni o ku malawa pe ke hoko ai ngahi palpare mai. O ku malawa pea e he COVID tahiwa peko ngahi serious infection kene hanga uesia ai palanisi au system malui. Peko taime uesia ai palanisi koni au system malui malawa le vai ke whengu fuange au o mau ngai whotuanga ke hange ko autoimmunity mo cancer foki. Ka ke ngatai I he malawa koni ke whawhanau vai la si o mo where ke ngahi kupu ke o tau sino o malawa le vai ke mo where foki pa mo ngahi sotia malui koni pea o kuna hanga rewa tamatei pe unohanga tamatei ngahi kupu ke koni o tau sino ko hua e vailasi. Pea whatahai ungo palparema koni o malawai ke tau pukelahi au pito pea malawai ke tau mau ai ke te lahenga whanga maari ke tau mau ai long COVID. Pea iha scenario e taha o ka pau te tau mau ai vailasi ka o kuyai ai ngahi antibodies pe mahaftau a system malui mehe kamataanga pea o kumalawa ke tau mau ai mahaftau goni a ke tau mau goni ai huhu malui. Pea I he tau mau goni ai huhu malui o kuhanga e he antibodies peko mahaftau o piki ki he vailasi o piki ki he spike protein peko ki foi tau o hae no koftua. Uni hanga rewa ta ofi ai vailasi me he hu ki ngahi kupu ke he au tau sino peka ke ngatai o kuni hanga uki ai ngahi sotia malu I kehe ke nau hau o tamatei ai vailasi. Pea ine pehe o kuni malu ki tau tolu me pukelahi au pito pea kuni malu ki tau tolu me mate pea kune malu rewa ki tau tolu pea me palparema koe ni ko long COVID. Ko long COVID ko ngahi palparema ke he ia hiri koe e te mau ai COVID tahiwa. Ko taha ine ngahi whakailonga o ku peko ngahi palparema o ke whepaki mo kakai toko lahi hiri koe e nau mau ai COVID tahiwa. Pea o ku kawai ai whela ngaki ai sino no e manawa pea wesia whoki ai pea moe atamai. O ku ke whoka ngai whakailonga long COVID, pea o ku whakatatau ki he ngahi kakai ke o ngai whanua ke. O ku malapa pea ke mau ai long COVID o ka pau o kai te ke pukelahi me COVID tahiwa. Ai kono uhingaini o ke uhinga pea ke pukelahi au pito, pea ke mau ai long COVID I kai. O ku malapa pea ke puke si or show mild symptoms, pea o ke malapa pea ke mau ai COVID tahiwa. A long COVID. Ko kakai o ku nau to ki sisino ange o ku lahianga e nau whanga maari ke nau moua I he long COVID pea o ku malawa ke nau te mau e long COVID o te lolo ange whoki. I anga whafuafua ko toko taha e toko tolu ko toa pe nau mau e COVID tahiwa te nau moua he ngahi whakailonga koni e long COVID o au ki he mahina e ono pe te lahianga hiri koia e COVID-19. O kia ngahi whakailonga ngā maheni, o ku kau e no e mana wā mo palparema i e ke te pe ma wesea tamai kaune ngahi palparema anga maheni o ku lahi hono ripoti e he kakai muna moua i he long COVID. Pea kumalawa ke wesea kakai ko toa pe me long COVID me he whanau wiki o au pe ke kakai lala. Pea koe ngahi whafuafuan i he taini miko pehe koe whafuafua ke pese te taha tolu o whanau waha ta ua ke taha taha. Pese te taha wha po nima o ke nau tolu waha ta taha ua ke taha ono. Pea ko ke nau tolu te lalahi ange i he tau taha whitu o ko te lahi ange a ke nau tolu e mo ua. Malawa ke mo ua nau sino i he long COVID whafuafua ke pese e tolu. Pea o malawa pe ke ngahi palparema tu pau o i kai te lava hana whai tō. O ka pau e re fulahi e mau o ku hoko i ho sino. O malawa pe ia ke te whainga taangi ki ho sino ke te recover pe me ngahi palparema koni. Ki whamalo ki whainga maarego ni ki whamalo ke Morris Hawkins Centre pe ki University o Kalani. Pea mo ke nau tolu ko toa pe i he re pina nau tokoni mo pou ki ona whotūtū. Mo no peer review ai ki i presentation gun e aho ni. I kai ki ngatai acknowledge TCCRG pe ko Tongan Community COVID-19 Response Group. Pa mo ki nau tolu kau ngāwe ko toa pe au nau kau i he tokoni mo pou ki o tau community tonga i kai ngata pe New Zealand kai he ngalo pe foki. Kai pe ki he Lave Mai Show. Pa mo e whainga maarie o i whiawhini ke whai ki presentation goni. Malo apita.
Malo apito Chris, I he whakamatala le koe ko tau whanongo ki ai. And thank you, Chris. So I'd like to hand over to Dianne, but before I hand over to Dianne, I just want to remind the viewers, please do put your questions and on chat, and then we will attempt to answer those questions after the presentation. Thank you, Dianne.
Aloha lele everyone, and thank you very much for the kind invitation to join you all. My name is Dianne Sika-Paotonu, and my mother comes from Holopeka and Hapai, Desa Latu, and my father, Devita Sika-Whanonga, comes from Neiafu and Bava'u. So again, malo apito, thank you again for the invitation to join you all. So Chris, thank you for talking about the virus, and I'm going to be talking about the COVID-19 vaccines and about what this means for us as Pacifica people. And so Timo, I'm just going to share my screen. Okay, so hopefully you can all see that now. And so to begin with, just wanted to remind us all that the COVID-19 vaccine works by teaching our immune systems how to fight the SARS-CoV-2 virus, which is the coronavirus that causes COVID-19. And so the vaccines that we have access to are able to stop COVID-19, but also prevent illness and also prevent death as well. And currently in New Zealand, we have access, our primary COVID-19 vaccine that we have access to is the Pfizer vaccine, but we also now have the AstraZeneca vaccine that's been made available. And of course in Tonga, both the AstraZeneca and the Pfizer vaccines are available. And the good news here is that both vaccine types are able to protect us from the Delta strain or the Delta variant of the SARS-CoV-2 virus that Chris has very kindly just talked about as well. Just another viral illness that is out there, but also where vaccines can help protect us, includes influenza, the influenza virus. So every year there's a flu vaccine here in New Zealand that's made available, and every year this flu vaccine changes. And the reason that it changes is because the virus changes as well. So the vaccine is adjusted and modified in order to capture the changes and to take these into account to ensure that people who do get the flu vaccine are protected from the influenza virus. So another viral illness that has been eradicated now is one that used to cause smallpox. So the smallpox virus, which you can see here in the top left-hand corner, is a virus that used to cause an infectious disease that killed a lot of people and has been around for many, many centuries. So an early version of the smallpox vaccine was generated with the help of cows, because believe it or not, but cows can also get their own version of smallpox. And so a very early vaccine was developed thanks to cows. And this was shown to be really effective in humans in order to prevent smallpox. And as you can see here, what the smallpox disease would cause are these blisters that would be seen all over the body, and that were very painful, but would also ulcerate and cause scarring as well. A lot of people died from smallpox, and a lot of cases of blindness occurred, and the death rate in babies sadly was very high. But as mentioned, this infectious disease was eliminated in 1918 because a more modern version of the vaccine was distributed globally, and the uptake was so successful that smallpox was eradicated. So another example of how vaccines can keep us protected from infectious diseases. And of course, back to the SARS-CoV-2 virus and COVID-19. So the Pfizer COVID-19 vaccine is a type of mRNA-based vaccine. And just to emphasize that there is no virus in this vaccine, there is no COVID-19, so you can't catch COVID-19 from getting the vaccine. In fact, this particular vaccine protects us very well from COVID-19. The AstraZeneca COVID-19 vaccine is a little bit different, but similar as well. And this is a type of DNA-based vaccine. And again, there is no COVID-19 in this vaccine either, so you cannot catch COVID-19 from this particular vaccine. And so to highlight the ingredients that are inside the Pfizer COVID-19 vaccine, this is what you'll find. There are 4 parts. And the first part is what's called mRNA. And this messenger or this mRNA is the active ingredient. So this is the part that stimulates the immune system to be able to fight against COVID-19. The second part of the vaccine is made up of fats. There are 4 different types. The third part is made up of sugar or sucrose, and the last part is made up of salts. And these salts help with pH balance, and they help keep the acidity of the vaccine at the right place. The sugar helps with protection, so this helps protect the vaccine, because remember the Pfizer vaccine has to be kept at minus 70 to minus 80 degrees Celsius, so it needs protection from those really harsh cold temperatures. The fats that are found inside the vaccine, these help with transport, and they help ensure that the mRNA gets inside our immune cells, so after it's been injected into the body. So the Pfizer vaccine is made up of 4 parts: the mRNA, fats, sugar, and salts, and that's all. And how the mRNA vaccine works is that the mRNA pieces are protected, and they're found inside these fatty particles known as lipid nanoparticles. And so what these fatty shells do is they keep the mRNA safe, and they also importantly help to transport the mRNA all the way to our immune cells after injection here in the arm. So this is what's injected into your arm, right? So this is the vaccine. The mRNA piece gets delivered into our immune cells, and the lipid nanoparticles, or this fatty shell, helps ensure that the mRNA piece reaches the inside of our immune cells. Then what happens is that piece of mRNA, or those pieces of mRNA, are translated into protein. So they're converted into protein. And the type of protein that's made is a harmless version of the spike protein that's found on the outside of the SARS-CoV-2 virus. So these harmless pieces of protein are then used by the immune cell to generate 2 large armies, one made up of antibodies and one made up of T cells that can fight and destroy COVID-19 or prevent COVID-19. And so that's how the Pfizer vaccine works. Now, this is how the AstraZeneca COVID-19 vaccine works, where instead of so what we're looking at here is the ingredient list. So instead of mRNA as the active ingredient, this vaccine, the AstraZeneca vaccine, has DNA as its active ingredient, and it's kept inside a shell of an adenoviral vector. So this adenoviral vector protects the DNA and also helps deliver it to our immune cells after it's been injected. The other ingredients that are found inside the AstraZeneca vaccine are amino acids, which help with stabilization, sugar, again for protection, salts that help with pH balance, just with the as with the Pfizer vaccine, and then there's a bit of ethanol or alcohol which helps as a preservative, some surfactant, and what the surfactant does is helps keep the ingredients together, and then there's water for dilution. So this is all that's in the AstraZeneca vaccine. So once the vaccine is injected, what gets into your body is the DNA that's inside this adenoviral vector shell. And that adenoviral vector shell helps deliver the DNA to our immune cells. So the DNA is delivered inside the cell, and then the DNA is released. That DNA then has to get converted into mRNA, and then that mRNA gets translated into the harmless spike protein. So there's a bit of an extra step here with the conversion of the DNA in the vaccine into the mRNA, which is almost the same as what's in the Pfizer vaccine, because what we're trying to make are the harmless versions of the spike protein, because that's what our immune cells can then use to generate antibodies and T cells that can destroy and prevent COVID-19 and destroy the virus. So in terms of side effects, there are mild side effects and there are serious side effects. The mild side effects are very, very common and lots of people have them. The serious side effects are very, very rare, and we hardly see these happening, but they can occur. So in terms of the mild side effects, what you can see here are the mild reactions that can occur with the AstraZeneca virus and the mild reactions that can occur with the Pfizer vaccine. Sorry, I meant the AstraZeneca vaccine and the Pfizer vaccine. And what you can see is that the side effects are similar between the two vaccines, but they just occur more commonly and less commonly in different proportions. So this is just a summary of the mild reactions. The more serious reactions that can occur, again, are very rare. And we do know about these that can happen. And what tends to happen with vaccine development is that in case some people were worried that down the track, we would all of a sudden discover some very rare but serious side effects, that's very unlikely to happen, because the pattern that we often see with vaccines when they are introduced, there are so many safety checks and regulations that are adhered to, that by the time the vaccine has been tested and lots of people are getting the vaccine, that anything really bad that's going to happen typically happens pretty quickly. So we've seen the most serious side effects that can happen, and again, just wanted to emphasize that these are rare. So in summary, the COVID-19 vaccine has to reach your immune cells in order to teach the body and to give the instructions to be able to respond against the virus and prevent COVID-19. And so this is how the vaccines work. So if we get the Pfizer vaccine, we've got the mRNA inside the fatty lipid shell that gets delivered, and this needs to injected and then needs to find its way inside an immune cell. And this is an example of an antigen presenting cell known as a dendritic cell. And it's our dendritic cells that can help generate our antibodies and also our T cells that can fight the virus, but also prevent COVID-19. If you get the AstraZeneca vaccine, you'll have, instead of mRNA, you'll have DNA inside a shell made up of the adenoviral vector, which helps deliver the DNA again to the immune cells so that the DNA can get inside here, inside the dendritic cell, and then can generate antibodies and T cells that can fight against the virus and prevent COVID-19. So this is another way of illustrating that. So if we get the Pfizer vaccine, we get mRNA delivered to our immune cells, and they can then generate antibodies and T cells that can fight the virus and protect against COVID-19. If you get the AstraZeneca vaccine, you'll get the DNA being delivered into your immune cells that can also generate antibodies and T cells. So just a reminder that whether you get the Pfizer vaccine or whether you get the AstraZeneca vaccine, you need 2 doses. And for the Pfizer vaccine, both doses are identical, and you need a 3-week gap in between the first and the second dose. So you need 3 weeks at least. And this is needed to help the immune response mature, because that first vaccine dose primes the immune response and you get a little bit of protection, and then you need a gap, you need time for that to mature, and then you get the second dose, which boosts the immune response that you can make. So you get stronger protection, but you also get longer lasting protection. And you're considered to be fully immunized 2 weeks after you've had your second dose. So just a reminder that you need 2 doses of the vaccine. And what this slide here is simply illustrating is that here in Aotearoa, New Zealand, even though we're dealing with a very serious Delta outbreak right now, we still have one of the lowest death rates from COVID-19. And so what you can see is Aotearoa, New Zealand here, we have a death rate of 0.7 per 100,000. And this is compared to the United States, which has a death rate of 232 per 100,000. And as Chris has very kindly reminded us, that globally, there have been approximately 250 million COVID-19 cases. However, this is considered to be an underestimate because remember, there are parts of the world where the infrastructure is such that they can't collect all the information that they can about people who end up with COVID-19. It's also conservatively estimated to have been 5 million, at least 5 million deaths. However, again, this is likely to be an underestimate, and the actual number is actually likely to be 3 times this figure. So we're looking at least 15 million COVID-19 deaths. In terms of the number of vaccines that have been delivered, 7.5 billion COVID-19 vaccines have been delivered globally around the world. So for us as Pacifica peoples, why is it that we seem to have a higher risk of COVID-19? So it was known back in 2020, thanks to data and information that came from the United States, which showed that Pacifica peoples living in America had a higher risk of becoming seriously ill, ending up in hospital, and sadly dying from COVID-19. Again, at the end of 2020, last year, thanks to the outbreaks here in Aotearoa, New Zealand, that this trend was also seen where it was shown that our Māori and our Pacifica peoples were at the greatest risk of needing hospitalisation due to COVID-19. So in other words, it was known that Māori and Pacific peoples were vulnerable to being disproportionately impacted and affected by the virus. And so why is this? And just to recap some of the reasons as to why this is the case. A lot of our Pacific people live in the Auckland region. A lot of our Pacific people work in MIQ facilities, and a lot of our people work at the border. So what this means is that our Pacifica peoples in Aotearoa, New Zealand are simply more likely to come into contact with someone who has the SARS-CoV-2 virus that causes COVID-19. Another reason is that we are more likely to live as intergenerational households. And what this means is that we often have little ones, very young ones living in our homes, and we also have very elderly living in our homes. And that is nothing bad. That's just the way we live as Pacifica peoples. However, what this means is that because of the virus, and remember, we're dealing with the Delta variant of the SARS-CoV-2 virus, which is more highly transmissible, that the virus can spread really quickly throughout our families, from our little ones all the way to our elderly. So again, it's not our people that is the problem here, it's the virus that's the problem. Another reason is that our people are more likely to have pre-existing health conditions. And what this means is that if we've got a health condition already, our immune system is likely to be busy taking care of this condition and trying to help our bodies fight and to be okay with another health condition or health conditions. So what this happens is that when COVID-19 comes along, when the virus comes along rather, is that the body becomes overwhelmed because it's already busy trying to deal with a previous health condition or health conditions. So this means that if you have a pre-existing health condition, you're more vulnerable to being impacted by the SARS-CoV-2 virus. Our people can experience barriers when trying to access healthcare. These can include transport barriers, language barriers, barriers with our health systems. What this means is that we don't necessarily get access to the healthcare that we need at the time that we need it, and this can cause problems. A lot of people in Aotearoa New Zealand have housing challenges. So we have a housing shortage, we have a housing crisis actually, and this affects lots of people, but we also have a housing supply issue where we don't actually have enough houses and homes to meet the demand. And so what this can mean is that lots of people can be living in one home or one house. And so for those of us who are Pacific, where we can be affected by having the Delta variant of the SARS-CoV-2 virus moving quickly in our communities, if we are living in an overcrowded situation, again, it's the virus that can spread really quickly within that household. So there is health impact, in other words. As Pacifica peoples, we can also face racism. We can experience racism when trying to access healthcare. And what this can mean is that we don't get access to the healthcare that we need at the time that we need it. So there are systems and designs that are such which can affect the healthcare that we can get access to at various times. And so this too can have health impact with the Delta variant. Financial challenges can also mean that we don't necessarily get access to the resources that we need to keep us healthy. For example, having access to a healthy home or to healthy food to be able to keep us safe and protected. So again, health impact because we're dealing with the Delta variant of the SARS-CoV-2 virus. So what does this mean for us as Pacific peoples? What this means is that it's important for us to be vaccinated. It's important for us to get tested, and it's important for us to follow the alert level rules to help others, but also to ask for help if we need it. As Pacifica peoples, we're vulnerable to being disproportionately impacted and affected by the SARS-CoV-2 virus and ending up with COVID-19. So we need to keep fighting to keep our families safe and protected. And just a shout out and a malo apito to all of those people who have been working to try and keep our families safe and to ensure that our people have been vaccinated with more Pacific, targeted and tailored vaccination efforts to roll out the vaccine and to keep our community safe. So malo alpito, and thank you very, very much again for the opportunity to share with you all tonight. So I've just stopped sharing my screen, and I believe there were some questions from last time that Chris and I were going to run through. So Seini and Losa, would you like to facilitate this, or would you like us to just quickly run through these?
Thank you, Dianne, for your presentation. It was clear about ko tui pek mahino ki he nihi ko of now sio mai ki kau mai ki he Zoom. I'm happy either way. I think Losa and I can easily ask the questions, whatever is easiest for you. The first question, Dianne, that was, will the vaccine used in Tonga have any negative impacts on pregnant women? And should they wait to have the baby first before getting pregnant? And I think this is an important question. Osi Lave Mai Losa ki whihui ko ni ki mua. Losa had asked a similar question in the previous segment that we had, but I'm guessing that there's more. It just led to more people wanting to know a little bit more. So if you and Chris could please answer that question, that would be awesome.
Okay, Marlo, thank you very much, Seini. So with respect to the question about pregnant women and vaccination against COVID-19, what evidence is showing is that pregnant women and newborn babies may be at greater risk of severe and really bad outcomes if infected with the SARS-CoV-2 virus and ending up with COVID-19. So currently in New Zealand, Pfizer is the preferred vaccine during pregnancy and is also available and now available in Tonga as well. And of course, the Ministry of Health advice here in New Zealand is that the Pfizer vaccine can be given at any time during pregnancy because it has been shown to be safe, and also doesn't just protect the mother but protects the baby as well, because antibodies can be passed on to the baby. So in other words, there's high risk for our mothers but also for our babies, and that there was some data that came out from the UK that showed that a lot of women who ended up in their ICUs, or some of the more critically ill patients due to COVID-19, were those who were pregnant and were unvaccinated. So in other words, with pregnancy, there is an increased risk of ICU admission. There's also an increased risk of the baby being born premature. There's an increased risk of having a stillbirth and of having a cesarean section. So what that means is that it's really important for pregnant women to get vaccinated.
Thanks so that malo pita Dianne. Ko e whehu koe ni pe oku wheunga ke oange nei e huhu malu i koenunga aki tonga ki na tolu oku wheta ma pe kono moni o kia e ngahi mon whakasai se Dianne ko osituku mai oku ki na tolu wheta ma oku te lahianga e whenga maari ke whakatu ta makia ngai e ko vitahi waka te ki na tolu ai kai ngata pe I whae ka I pe foki. Pea oku whatu tā makianga e ko vitahi wā I hano whakatatau ke hukumalui. Pea ko hukumalui ko osi ata me foki ngai whakamatala e tai nimi, ngai whakamooni oku seifi au pito ai hukumalui ke kinau tolu whetā mā pe amanaki ke nau mau whānau. Pea oku seifi ki he whae I kai ke ngata au te seifi foki ki he pepe he oku malava pe ke tofaki antibodies pa ka whanki maftau ko ni o malava ke to inasa mo pepe pa ke whaiaho no malu e pepe. Ko tui mahalo ko e tāri vema tokoni ki he whehui ko ni malo apito.
Thank you, Chris. Thank you, Dianne. Another question that we want to ask is, how can people still get COVID after being fully vaccinated?
Malo Losa, and that too is a really great question. So what the vaccine does, the COVID-19 vaccines prevent us from serious illness, hospitalization, and also from death. So in other words, it is still possible to be infected with the SARS-CoV-2 virus. However, what has been shown with the Delta variant is that although you might be able to pick up an infection, you will be able to fight against that infection really, really quickly. So in other words, your virus levels can go up, but they will go down very, very fast compared to someone who hasn't been vaccinated. And what's also been shown is that the quality of the virus particles that you might be shedding or that you might be passing on to others is affected if you are vaccinated. So what this means is that you are less likely to be making other people seriously unwell. So the vaccines do prevent us from serious illness, hospitalization and death. However, you can still get infected, but your virus levels will go up fast, but they will come down really, really quickly. So in other words, you'll clear the virus faster if you've been vaccinated than if you haven't been vaccinated, and you are less likely to make other people seriously unwell.
Yep. So oku malava pe ke mau e ko vitahi wā iyo. Ka koe moment o ka pau ke oskuhu malu. Ka ko kinau tolu ko oskuhu malu I. Ka time ko ke mau e ko vaila si oku hanga e ho si noia o malava ken hanga o tamatei pe clear ai vala si vave au pito o whatatau ke toko taha koe o wika ke huhumalui. Pe o kumahoinga fuke whatonga ko huhumalui o kune malu ke tau tolu me he puke lahi au pito pe me toko to whare mahaki pe me ma te fuke. Ko ngā wea e huhumalui kune whai. Pe a ko kinau tolu ko kuna mau ai vaila si o kuna o suhu malui, o ku waweanga e whenga maari ea ke tamate ea walasi, pe ta ofia a ene mowhere whakasisi ai e whenga maari o ene mowhere, pe whakasisi ai whenga maari kene wesi ai koe. Ai au mahu inga au pito, ke mau ai huhu malui, koe whaunga ia hono malui e koe, mono whakasisi, e te mowhere atu ai walasi me te koe ke atoko taha kehe fo.
Malo pito, Chris. Chris and Dianne, you both directly and indirectly talked about long COVID. Question from one of our viewers in the last segment was, how has long COVID acted out with those, especially our elderly population with NCDs? So Dianne and Chris, again, how has long COVID acted out with those with NCDs?
Malo, Seini, so I might hand over to Chris for this question, but just to make a couple of comments initially, and that is that long COVID can affect anyone, and although a lot of people might get infected by the virus and they might get better and be totally fine, there are some people who will get infected and they will never be the same again. And sadly, what's also been shown is that our little ones can pick up this long COVID-19 condition. And what I'll do is I'll let Chris just revisit what it is that he shared, because he presented that so nicely. If that's all right, Chris, to respond also.
Yeah, that's a good question. I haven't seen or come across anything yet regarding any underlying comorbidities and whether it's related to long COVID. So most of the reading that I've done have just noted, the age and long COVID conditions. Now it's unsure whether these conditions will be likely a result of the underlying comorbidity, or whether it's just the condition of having long COVID in healthy people as well. So I'm not sure about that scenario, whether there's a link between long COVID and underlying comorbidities. Is something that I'll have to go back and revisit again. But what I can say is that those with higher BMI, they have a higher chance of getting long COVID and having long COVID for much longer. And for reasons we're not completely sure yet, but this is something that that people have started to notice across the world. So, o te ege fuaha ha whakamatala tūpau he tainimi o whekaake me ngai whokotua ngā kehe, pia moeanga ine whelawei ki he long COVID. Kako mea peo ko mahina mai tainimi ko ki nau tolko o te ki sisino ange, o ko te lahiange ai whainga maari e ke nau mau ai long COVID, pia te lahiange ai whainga maari ke nau mau o te loloang. It varies widely between people and between different countries as well. And so we will need to have to do our own study here in New Zealand with our own population to be able to look at what these long COVID symptoms are.
Malo, Chris, thank you, Dianne. I think I'm just checking out with our time, and I'm mindful that we have got about 10 minutes left. I think what I'm going to do next is going to ask both of our immunologists to share with us a little bit about your journey and pathways to becoming an immunologist. O mahu inga pe ke tau ke mau whanongo atu mai kainga ke moa I he halafononga koe nuk moa mai ia ke moho ko ke immunologist tonga in New Zealand. Malo, Chris.
Maybe ladies first. Dianne, do you want to go first, and then I can?
Oh, yep, no problem. Malo, thank you, Chris, Losa, Seini, and the team. So when I was little, we had a family friend here in New Zealand who passed away from cancer very, very long time ago. And although I was quite little, I would have been about 8 at the time. And although, not foreign to death, I mean, we went to church, with mum and dad, and so, we'd been to lots of funerals. However, this was the first time that I'd actually seen someone become sick over time and become so unwell that they then eventually passed away. And at that age, I made this big promise to my mum, Lisa, that I was going to grow up and cure cancer. And so, so I've sort of gravitated towards health sciences and biomedical sciences, in order to try and fulfill this goal, or this big promise that I'd made to my mum. And perhaps maybe just to help set the scene for you all, I have just one brother, so there's just he and myself. So we're a small Pacific family, and my parents came from Tonga in the 1960s. My father used to play rugby for Tonga, and he left his rugby career to marry my mum. Mum was Seventh-day Adventist and went to church on Saturdays, so my dad couldn't go to church anymore, and couldn't play rugby anymore. And so we came here to New Zealand and settled here, and mum worked a number of jobs to help ensure that we had everything that we needed. And my father worked really, really hard. He worked for Todd Motors, which turned into Mitsubishi Motors. He worked there for more than 30 years to provide for our family and to ensure that my brother and I had the opportunities that that he and my mum hadn't had. And so in other words, they sacrificed a lot for us and supported us. And so as I was sort of moving through my education, I have a lot to be thankful for, and with respect to the sacrifices that they've made. And so continued to pursue science, and all the way through secondary school and university, and then eventually finished my degrees, finished my PhD, did my PhD at the Mulligan Institute in Medical Research, and was part of the cancer vaccines team there. So we're working on cancer treatments or therapies to help people who already developed cancer to strengthen their immune systems to destroy cancer cells. And sadly, my father passed away just at the start of my PhD. So I was really sad not to have him there at the end, but nevertheless, out of respect for his sacrifices over the years and of that by my mother, it was still a really, it was a time to celebrate for us for more reasons than just achieving a PhD. For me and my family, it was so much more than that. So so thank you for giving me the opportunity to share that. And Chris, over to you.
Thanks, Dianne. With me, I went to school in Tonga, came back and finished off here. I was always kind of intrigued with science. I was really drawn and interested in discovering new things and finding out new things. And so I thought, I'll go and do an undergraduate degree in science. So I went and did an undergraduate degree in science. And I thought that once you had just gone to uni, your life is, you'll be sorted for life. I went and did my undergraduate degree, and I came back and I started looking for work. I went into teaching. And then when I went into teaching, I found that some of the stuff that I was teaching the kids, I thought, wouldn't it be nice to be able to contribute to finding out more information to teach our younger people? So I went back, and I came back here to to New Zealand from Tonga, and I did a master's degree. I wanted to go back and do my master's. I did that in viruses that infects plants. And at that stage, a really close friend and an uncle, my uncle, who was, also a friend of mine, had passed away from cancer as well, and his name was Kurukuku, a really close friend of mine. And at that point in time, like Dianne as well, I thought, I'd like to dedicate whatever it is that I can do to contribute to finding, again, a cure to cancer or contribute to that knowledge. And so after my master's, I was fortunate to be given a scholarship. And so I thought, okay, I think my prayers have been answered. I can now do a PhD. And so I started off in a lab that looked at trying to cure cancer by enhancing the immune system to better able to fight the cancer. And slowly over my journey, my PhD started to change a little bit. And so it became a much more broader looking at genetics as well. And so that's how I got into immunology and studying the role of genes that Māori Pacific people have and how that works in immune function. And ever since then, just those two things combined, genetics and immunology, that's the thing that I wake up for and that I look forward to doing every day, and hopefully be able to contribute to finding some cures for our Pacific people and cancer as well. And I wanted to dedicate my PhD to my uncle. Yeah.
Malo opito, Chris and Dianne, for sharing your story. And I think, we've acknowledged time and time again that you're both immunologists, but it's great to hear the human side of you, your stories, and why it is that you chose to venture into a career in these different areas. I know for us as Tongans, our why is always connected to other people. And so we thank you for gifting us with those stories. And I, like many others, have lost a lot of family members to cancer. And so I actually feel a lot better knowing that we've got some of our own who are in that field of research, trying to do what a lot of us are praying God will do. So, I guess our prayers is that God continue to give you both the wisdom that you need to do the work that you're doing moving forward. I'm just going to hand it over to my co-host Losa to see if for her final remarks as well.
Well, thank you, Seini. Thank you, Dianne and Chris. I just wanted to echo what Seini was saying. We shared our challenges in our journey, but it all comes back to our families, and we serve us, in our journey. And our words of encouragement, I suppose, for our listeners and for our families and for our young people is there is opportunities for them and for all of us to make a difference. Koia ko whafofonga atu e whamalo he whiawhiko e niko hiko tuku taimi vahe mai ki tau ka ngā whetoko ni aki I he ngā oko tā pēo tau whai o maho I ngā ia au pito he tuk whainga maali e ko o mai ki maua ki makau he polokalama I whiawhiko e ni ka pehefu ki whanonga mai o tau kāinga. I was going to say, Seini, can I come back to you to say our final prayers for us, Pamole Mole?
Yeah. Okay, malo apito Losa. I know that the New Zealand Methodist Church have just finished their annual conference, and so I actually wanted just to a reminder just to close us off with a reminder of by John Wesley, who said, "Do all the good you can, by all the means you can, in all the ways you can, in all the places you can, at all the times you can, to all the people you can, and as long as ever you can." Ke tau lotu. Tamai math ko mau tamai whaewani a whina. Mau tūnun mai tua whaamalo mo whawhitai ki ati koe, ko hea koe ofa mai tau hiu ki whae mai mau mo ui. O mau tue au sia a e whia whakoloani. E ki o mau whawhitai ki ati koe. Iho o mai whainga maalie ki mau wahe. He ilo nā au ngai mea o mau wahe ki ani ihi o nau whanongo mai. Mau kole e ki whamole tuku mai. Tawa ki a Chris ka mātai e mai ngā ua na whai. Pake hoko e ki ngahi talanoa mai ngā ua mau whai ko ha mea ki whakalanglangi a ki a Fiona. Pake aonga ki o kakai. no fo ia ia ki mau tolu, pa ki mau nofu mau pe, he mal ofa a whiona, sisu kalais ko mau whamu ui. Amen.